The health minister expected compliance. After all, he represented the Argentine government, and Che was just a student. But when Minister Rodriguez demanded Che stop treating poor children, he discovered that some people can't be intimidated, especially when children's lives are at stake. Buenos Aires, March 1948. In the narrow streets of Villa Miseria, among the tin rooftops, there's a small building, an old shop, now being used as a temporary health clinic. On its door, a handwritten sign, Free Medical Aid, Dr. Ernesto Guevara. Che isn't a doctor yet, fourth-year medical school student, but the children here call him Dr. Ernesto, because he treats them like a real doctor, cares for them like a real doctor, heals them like a real doctor. The clinic opens at 8 in the morning. There's already a line at the door, mothers holding their children, older kids waiting hand in hand. They all have the same problem. No money, no doctor, no hope. Che enters, puts on his coat. He has simple equipment, stethoscope, thermometer, some basic medicines, most bought with his own money. He's poor, but he does this work because it needs to be done. First patient is 6-year-old Maria. She has high fever, coughing. Her mother Isabella waits with worried eyes. Doctor, my daughter has had fever for 3 days. What will happen? Che examines Maria, listens to her lungs, looks at her throat. Signs of bronchitis. Needs antibiotics. But antibiotics are expensive. Maria's family can't afford them. Che makes his decision, gives the medicine for free, prescribes antibiotics he bought with his own allowance to Maria. It'll pass in 2 days, he tells Isabella. Next patient is 4-year-old Carlos. He has stomach pain, vomited. His mother Rosa is worried. Doctor, the child won't eat anything, cries constantly. Che examines Carlos. Could be stomach infection, or poisoning from bad food. In this neighborhood there's no clean water. Hygiene conditions are terrible. Children get sick constantly. Rosa, give Carlos sugar-salt mixture. Plenty of fluids. If it doesn't pass by evening, bring him back. Che doesn't ask for money. Never asks for money. Because he knows these families have no money. How can a father earning 1 peso a day pay for doctor fees for 5 children? Afternoon the clinic is more crowded. Che is tired but continues. Every child is special to him. Every patient is important to him. 3-year-old Ana comes in. She fell trying to walk, hurt her knee. Che cleans the wound, bandages it, gives Ana candy. Ana smiles, says thank you. 7-year-old Pedro comes, has eye infection. Che prescribes special eye drops, shows Pedro's mother how to apply them. This continues. From morning to evening children come. Che sees them all, tries to heal them all, without money, without compensation, just listening to his conscience. But everything is about to change. Third week of March 1948. Che is working at the clinic as usual. Outside a black Mercedes is parked. Seeing a Mercedes in Villa Miseria is very rare. 2 men get out. First is Health Minister Dr. Eduardo Rodriguez, around 50, expensive suit, gold watch, Argentina's health minister. Second is his inspector Dr. Morales. Both look serious, official. They enter the clinic. Che is examining little Luis at that moment. Luis has fever. His mother waits worried. Excuse me, says Minister Rodriguez in a stern voice. Who are you? Che looks up. I'm Ernesto Guevara, medical student. Medical student. What are you doing here? Taking care of patients, sir. Minister Rodriguez looks around. Simple equipment, poor patients, temporary setup. What is this? What kind of clinic is this? We provide free healthcare, sir. Rodriguez's eyebrows furrow. Who gave you authority? Authority, sir. Yes, authority. You're not a doctor. You have no license. This is illegal. Families in the clinic listen silently. Children are scared. Mothers worried. Who are these men? Why are they scolding Dr. Ernesto? Che tries to stay calm. Sir, I'm just helping patients. I don't take money, just. Rodriguez cuts him off. It doesn't matter if you take money. You're practicing medicine without authorization. This is a crime. Crime, sir. Of course crime. You can't treat patients without being a doctor. There are rules. Che stands up. He still has Luis's examination paper in his hand. Sir, what about these children? What about them is none of your business. Where else will these children go? Which hospital? Which doctor? Rodriguez shrugs. That's not my problem. My problem is enforcing the laws. And at that moment Che's response will change not only Minister Rodriguez but the entire understanding of the system. Che takes a deep breath, looks into Minister Rodriguez's eyes. Sir, if laws allow children to die, those laws are wrong. Rodriguez is shocked. This young man is defying him. Who are you to judge the laws? Who am I? I'm someone who's been working here for 3 months. Someone who knows these children. Someone who healed Maria's bronchitis, treated Carlos's poisoning, bandaged Anna's wound. Rodriguez, angry. This is illegal. Che raises his voice. What's illegal is these children remaining without treatment. What's illegal is these families not being able to afford doctor fees. What's illegal is the system forgetting these people. Families in the clinic pay close attention. Dr. Ernesto is defending them, standing up to this powerful man. Rodriguez, threatening, young man, I'm the health minister. I'll shut down this clinic. Che doesn't back down. Shut it down, sir. But provide another solution for these children. What solution? Free state hospital, special section for poor children, mobile health service for this neighborhood. Rodriguez can't answer, because such services don't exist. The state has forgotten poor neighborhoods. Che continues, sir, I'm not challenging you. I'm seeking solutions. These children need solutions. Rodriguez makes another move. What do you tell these children's families? They're receiving illegal treatment. Che smiles. Ask them, sir. Rodriguez turns to Luis's mother. Senora, this young man isn't a doctor. You're taking risks. Luis's mother Maria responds, Senor, Dr. Ernesto healed my son. No other doctor looked at us. Rodriguez turns to another mother. What do you say? Isabella, Maria's mother, responds, Dr. Ernesto saved my daughter's life. She had fever for 3 days. Now she's getting better. All mothers say the same thing. Dr. Ernesto cares about us when no one else does. Rodriguez is cornered. Families support Che. Children love Che. This is exactly when Che's final words will change everything. Che approaches Minister Rodriguez. Sir, let me make you an offer. What offer? I'll close this clinic. But I want something from you. What? Bring real healthcare to this neighborhood within a month. Send doctors, send medicines, provide free treatment for children. Rodriguez pauses. And you? If you provide this service within a month, I'll withdraw. If you don't, I'll reopen. Rodriguez thinks. This agreement seems reasonable. Fine, agreed. But I have one more condition, sir. What? I'll continue working during this month, because these children can't wait. Rodriguez wants to object, but Che continues. If you try to stop me, I'll call journalists. I'll tell them how the state has forgotten poor children. Rodriguez takes this threat seriously. Doesn't want scandal. Okay, but only 1 month. Only 1 month. They reach an agreement. Rodriguez leaves the clinic. But the truth is, Rodriguez has no intention of bringing healthcare to this neighborhood. He's waiting for Che to give up. A month later, as Che expected, no development. Rodriguez hasn't kept his word. Che reopens the clinic. This time Rodriguez comes more harshly. You broke the agreement. Che responds, no sir, you broke it. You didn't send any doctors here. Bureaucratic processes take time. Children can't wait for bureaucratic processes while they're dying. This argument makes it to the newspapers. Headlines like Medical Student Defies Health Minister for Poor Children appear. The public supports Che. People start donating to the clinic. Medical students want to volunteer. Rodriguez has to back down. Because public opinion supports Che. 6 months later, mobile health service really comes to Villa Miseria. State doctors start treating poor children. Che has achieved his goal. Now he can close the clinic. Last day, the last patient is little Luis, the child who came in. His fever has dropped. He's recovered. When he sees Che, he runs, hugs him. Dr. Ernesto, thank you. Che strokes Luis's hair. Luis, what will you be when you grow up? I'll be a doctor, like you. Che smiles. Very good, Luis. But don't try to be like me. Be better than me. 20 years later, in 1968, Luis really becomes a doctor, works in Villa Miseria, treats poor children, provides free treatment. In Luis's clinic, there's a photograph. Che Guevara in 1948, in Villa Miseria, with children. Written below, a real doctor treats not only the disease, but also the system that causes the disease. Minister Rodriguez retires in 1955. After retirement, in an interview he says, in 1948, I argued with a young medical student. At that time I tried to stop him. Now I understand he was a greater doctor than me, because he diagnosed not only patients, but also the system. So I ask you, what's your Villa Miseria clinic? In which matter does the system tell you illegal, but your conscience says necessary? Maybe speaking truths on social media, maybe opposing injustice at work, maybe voicing problems in the education system. Che Guevara in 1948 didn't just treat children, he tried to treat the system too, and he succeeded. Which system are you ready to treat? And do you have the courage to fight powerful people like Minister Rodriguez for this? Because sometimes real doctoring is healing not just the disease, but also the conditions that cause the disease.